Hey folks, getting our cameras lined up here. So if you're new to the show, we have several cameras running. So John, my producer, has to get all the cameras lined up and everything. So I have to talk to you for a few minutes until he gives me a thumbs up and he lets me know all the cameras are working. And he just did. So I can start talking to you online here. Welcome. I'm Dr. Joe Esposito. The way the show works, if you're new to the show, I talk for 24 minutes. At the end of 24 minutes, during that 24 minutes, any health questions you have, type them in on the platform that you're on. John is going to read me your questions at the 24-minute break. I will then answer your questions. I don't know who you are, so you don't have to worry about, oh, Dr. Joe is going to... John just reads me questions. I know nothing. I'm going to do another 24-minute segment, and then I'll answer more questions. So this is a great opportunity to get your questions answered. Please share this with everybody in your contact list. These shows are life-changing, every one of them. And my goal of always is to naturally get you well and keep you well. So that's my job. So if John gives me the thumbs up, which he just did, we are ready to start. Hey folks, Dr. Joe Esposito here. I am glad you're with me today, as I always am. Today, we're going to talk about obesity, but not just obesity, the impact it has on back pain, blood pressure, cancer, and diabetes. Now, I've been in practice about 40 years now, and I've seen a lot of patients, many patients. And many times patients come to us with neck pain, back pain, shoulder pain, but they'll listen to my podcast, they'll hear my radio shows, they'll read my books, and they'll say, well, doc, I also have some other issues. What can I do about my type 2 diabetes? What can I do about my blood pressure? And I tell them the same thing, and I'll tell you the same thing. I want to help get you off your medication, but I'm not going to take you off your medication. I want to get you well enough so that maybe we can reduce or eliminate the need for some or all of your medications. But you need to talk to your prescribing doctor about coming off it. I'll help. We'll co-manage the case. I'll manage it from a holistic, natural standpoint with chiropractic, nutrition, whatever we need, supplements. And then you talk to your doctor and let's see if we can work together. But let's talk about what happens. Because like we used to think with cancer, I'm going to cover that in just a second, but I want to jump ahead a little bit, that sugar fed cancer molecules. Well, it turns out sugar causes the liver to produce a certain type of fat, and that feeds the cancer molecules. So it wasn't a direct correlation, it was an indirect correlation, but it's still caused by sugar. And so that's where I want to talk to you. I want to get to the cause of the issues and discuss certain options that maybe will help you in the long run. So let's jump right in. Losing weight can help with pain reduction, hypertension, cancer risks, reverse type 2 diabetes. Really is an important thing. So I've read this great article. I'm going to steal it from it. The ABCs of weight loss. A stands for arthritis. B is for back pain, and B is also for blood pressure, and C is for cancer. But what is arthritis? There's two types. There's rheumatoid and there's osteo. Rheumatoid arthritis is an autoimmune disease. The body is attacking itself. Osteoarthritis, which is way more common, is when bones are out of alignment, rubbing up against each other and wearing out. So osteoarthritis' main component is mechanical. Bones are out of place, wearing out. So I ask you this question. If the tires on your car are out of alignment, what do? We get them realigned. Why? So the tires don't wear out. If the bones are out of alignment, what should you do? Get them realigned so that the joints don't wear out. It couldn't be any simpler than that. Now, getting the bones back in place, will they hold there? How much damage is done? Those are all extenuating circumstances. But the bottom line is if you have osteoarthritis, its main cause is something's out of alignment. And no matter how far along this arthritis is, you want to put it back in place. If we put excess weight or strain on that joint, it exacerbates or speeds up the arthritic process. So A, the ABCs, A is for arthritis. We want to get that weight down as quickly as possible to take the physical stress off the joint. And then, of course, if bones are out of alignment, it can cause back pain, which is B, AB, right? ABC. So it's not just a risk factor for other things. It's also a risk factor for mechanical stress on the body. And that's why I don't want you to lose weight because I want you to look pretty. I want you to lose weight for the health reasons behind it. So B is also for blood pressure. Excessive visceral fat. Now, there's fat that's like underneath my skin. If my arms are fat, let's say, that's not visceral fat. But if I have fat around my organs, the viscera, it's also called the organs, internal abdominal fat can physically compress your kidneys. And when it physically compresses the kidneys, it can squeeze the blood vessels, and the pressure can essentially squeeze sodium back into your blood system. Your kidneys are trying to pass it out, and your bodies are pushing it back in again. The combination of the obesity and the hypertension can have a disastrous effect on your health. And again, I've seen thousands, may I say, maybe even tens of thousands of patients over my career. But the good news is even just a little bit of weight loss, not much, even just a little bit, can help tremendously. I just saw this great research article on these GLP-1 agonists and how they help you lose weight, and they absolutely do. But let me explain to you what happens. You can lose 30 to 40% of the weight that you lose. 30 to 40% of it, depending, 25 to 30, depending on the study, is muscle mass. It's not just fat. So if you lose 25% of your muscle mass, let's go to a really low number, just 25%. So I lose 4 pounds, 1 pound is going to be muscle. It's really hard to build that pound of muscle back up again, and especially if you're older. And so now the muscles support the bones. And if muscles support the bones can move out of place and pinch the nerves, and the nerves control everything. Could be pain, but 90% of your nerves don't feel pain. They control organs. So you can lose weight on these GLP-1 agonists. As soon as you stop, the weight seems to come back. That seems to be a theme that's happening. And we are seeing things like digestive issues, nausea, diarrhea, constipation, optic nerve damage. So there are long-term side effects to this, and we're not going to know all the long-term side effects until long-term comes, and then it might be too late. So losing weight is important, but I'm not a big fan of making that happen because you're losing so much weight. And you never really get skinny on these medications because you'll lose some weight, but then you'll hit a plateau after about a year. And in order to maintain that plateau, even though you're not at your target weight, the studies are showing you need to take this. It's a forever drug. As soon as you stop, most people gain the weight back, but they don't gain back the muscle. They just gain back more fat. So Elvis Presley said, I'm caught in a trap. And we are. We're caught in a trap. We do these things. Now, I'm not saying that I'm not against drugs and I can't prescribe drugs or not prescribe drugs. That's not my job. That's your doctor's job. But I want you to think about impact and the ramifications of what you're doing. So blood pressure, again, disastrous impacts. The good news is we just lose a few pounds. It takes a lot of stress off the body. Researchers found that losing about 9 pounds may lower blood pressure as much as cutting salt intake in half. So just 9 pounds. And it's challenging? Yeah. Is it worth it? Yeah. So A is for arthritis, B is for blood pressure and back pain, and C is for cancer. We're talking about the ABCs of obesity. 3/4 of the people surveyed were unable to begin, for being overweight or obese, were unaware that being overweight or obese can increase your risk of cancer. So that's another thing we have to look at. Based on a comprehensive review of more than 1,000 studies, so we took 1,000 different studies, looked at it, excessive body weight raises the risk of most cancers, including esophageal, stomach, colorectal, liver, gallbladder, pancreas, breast, uterine, ovarian, kidney, brain, thyroid, and bone marrow. That's a whole lot of cancers, isn't it? Now, what's interesting, I'm going to get to this in a second, if you've had a gastric bypass surgery, it doesn't reduce your risk of cancer. I'm going to explain why in just a second. Now, chronic inflammation from the obesity can cause high insulin levels due to insulin resistance, and women, it could be due to excess estrogen. Now, estrogen is a hormone, and one of the things that estrogen does is it causes you to lay down fat. Fat then produces estrogen, which causes you to lay down fat. So once again, we quote Elvis again, I'm caught in a trap. You're caught in a cycle. And this is one of the reasons why it's difficult for women to lose weight, because they become estrogen dominant. Men become estrogen dominant too, but it's a little easier for us, and that's just how life goes. So after the ovaries shut down in menopause, this is something else I want you to consider. The fat takes over as your principal producer of estrogen. The ovaries produce estrogen. You go through menopause. Fat now takes over that job. That's why women who are obese are nearly twice as as high estrogen levels in their body, because what happens is the fat is producing estrogen, and estrogen can cause abnormal cell growth, which is also called cancer. Data on prostate cancer isn't as strong, though obesity is associated with the risk of invasive prostate cancer as well. So one of the reasons that we're confident between the link of obesity and cancer is not a direct problem, but an indirect problem. Like we said, it can cause sugar can cause you to gain fat, but sugar can also produce these types of fats that feed the cancer. But if you have bariatric surgery, okay, what happens is it doesn't lower your risk of colon cancer like regular weight loss would, but it can actually increase it. And one of the theories behind it is, we think this is what it is, it can increase the risk because when you rearrange the anatomy, more stomach acid can get into the intestine, and that can irritate the intestine and cause cancer to grow. So losing weight, very important, except for if you have the bypass. It can actually increase the risk of colorectal cancer. So either way, regardless of what it is, we need to get the body functioning the best it possibly can with the parts that you have and getting the nutrients that you need. I had a patient this week, and he came to me from a car accident. Never heard of me before. Came in. He heard we do car accidents. He said, I hear you the best. I said, well, thank you. I appreciate that. And we started talking. He says, oh, by the way, I had stomach surgery, stomach cancer, and they removed a piece of my stomach. Is that going to impact my healing? And I said, yes, absolutely, because you're not absorbing nutrients like a normal stomach would. You may not be passing out waste products. He says, I have horrible acid reflux. So I explained to him, you got to pull the stomach away from the diaphragm. We got to get you on a dietary protocol. And he said, how come no other doctors have ever told me this before? He didn't even come to me for nutrition. He just came to me for a car accident. And he says, all the doctors I've been to, nobody ever discussed nutrition with me, with my cancer. And I said, well, I'm not saying I can cure cancer. I'm certainly not saying that. But I believe that that should be absolutely part of a protocol. You don't have a piece of your stomach and you had cancer. 2 reasons why you should have a nutritional workup. And he looks at me and he smiles. He goes, I think I'm in the right place. I said, thank you. I think you are too. So ABCs of weight loss. We talked about A, being arthritis, B, being back pain and blood pressure, C, being cancer. Let's go to D, diabetes. It's a consensus by the International Diabetes Federation. Obesity is considered the single most important risk for developing type 2 diabetes. So it's the number 1 cause. So why wouldn't we address that? And I wish we would, but not a lot of people do. And I'll be honest with you. The bad food tastes good. I get that. I understand that. And it's part of what we call food science. There are chemists out there that work very diligently to get you to eat more of their food. We learned that monosodium glutamate works really well for that. MSG, monosodium glutamate, glutamic acid, stimulates or excites the umami taste buds in your tongue. Umami is a real word. And umami is savory. So we have salt, sweet, bitter, and now we have savory. Umami taste buds are a relatively new discovery. I mean, certainly within my lifetime. And so if we do monosodium glutamate, we stimulate the umami taste buds and makes food taste better. It's a flavor enhancer. That's how it works. And so it tastes better, so what do you want to do? You want to eat more. And it's not a secret that the combination, the best combination that we can have to make you want to eat more is carbohydrates, fats, and salt mixed together. And what's the classic food of carbohydrates, fats, and salt? Potato chips, or really any kind of chips. And that's why when you start eating chips, it's really hard to stop. And it's hard for me, and it's hard for most people. Every now and then somebody says, I don't have a problem. Well, okay, you're the exception, not the rule. So we're getting you to eat these foods, regardless of what it's doing to your health, we're selling more of the product. And that's the business's job, is to sell more product. It's not their job to take care of you. My job is to help take care of you. Type 2 diabetes, also a leading cause of kidney failure, lower limb amputation, adult onset blindness. And ironically, many of the leading drugs that treat diabetes cause further weight gain, which gets you into this vicious cycle. Now, some of the new drugs, like you know about these drugs, they work for obesity and they work for diabetes. And those drugs, those GLP-1 agonists, they were never intended to be used for weight loss. They were originally intended for diabetes. That was it. Very simple. And then people said, oh, I'm taking these. Not only is my diabetes getting better, I've lost my appetite. I'm not eating much. I'm losing weight. That's great. And one of the other things that it does, not only does it have you eat less food, it has you eat less junk food. And so this is one of the reasons why people that are on an all-meat diet, they say, oh, my blood pressure dropped. I feel great. Now, long-term, it's going to cause problems. I'm not a fan of an all-meat diet or a high-protein diet like that. But one of the reasons is not so much eating the meat is good for you. It's that you're eating that and not eating the breads, cookies, cakes, donuts, pastas, processed oils, omega-6 fatty acids, polyunsaturated fats, additives, dyes, chemicals. You're eating just a whole food and not eating the processed foods. And just this morning, driving into work, there was a study on the radio, my radio station, and they said that 80% of the food in the grocery store now is what we call ultra-processed foods. 5 or more ingredients and food ingredients that you normally wouldn't have in a regular kitchen. 80% of what we're selling in the grocery store is ultra-processed foods. And all the research I've read is that ultra-processed food is dangerous for many different things. I did a show on that a couple of weeks ago, actually. So we got 80% of our diet is ultra-processed food, or 80% of the food we sell. Some people it's 100%. Ultra-processed foods, all negative side effects. We talked about the ABCs and Ds of weight gain. And we're going to talk about what to do about that in just a second. So let me just recap that real quick. Obesity increased the risk of back pain, sciatica, lumbar disc degeneration, high cholesterol, inflammation, and that can restrict blood flow to the spine, and that's going to the spine doesn't heal as quickly as it should. And even losing a few pounds can do wonders. Every patient that comes in our offices, and I've been in practice 40 years now, every patient that comes in now, we do a nutrition workup on. And many people say, well, I'm not here for nutrition. I'm here for back pain. I'm here for traumatic brain injury. I'm here for digestive issues. And I tell them. In fact, last week I did a show, and we said that you can reduce pain up to 38% with diet alone. Just changing your diet can be used as pain management. And I'm the only chiropractor in the whole state board certified in pain management. And all my pain management colleagues, none of them, zero, talk about nutrition that I know of. They send me their patients all the time. Go see Joe. We need your help. But zero doctors. And there's a technique now. Success rate up to 38%. And it's absolutely free. All it is changing your diet. And so that's why it's so important. And if we have this extra weight, it can cause a lot of back pain. Now, obesity raises risk of many types of cancer. We said breast, liver, colorectal. These cancers are due to chronic inflammation, high insulin, and in women, increased estrogen levels. And then the weight loss through bariatric surgery, we said, can actually increase your risk of colon cancer. So that's a side effect they don't really talk about much. And obesity is the primary risk for type 2 diabetes. And lifestyle changes targeting obesity can be more effective than medications, which may increase further weight gain for diabetes. So we have, once again, I'm going to say it, the most effective, least expensive treatment for arthritis, back pain, blood pressure, cancer, and diabetes. Now, is it going to solve all the problems? Absolutely not. But it's the most effective, least expensive treatment overall. If you had to go to the mechanic for your car, and you got 3 different estimates, and the one who gave you the lowest estimate does the best job, who would you go with? Well, the one who does the best job for the least amount of money, right? Here we have that protocol in healthcare, and we're doing the exact opposite. There's no logical sense here. So if you have problems, neck pain, back pain, shoulder pain, digestive issues, you want to help lose weight, brain issues, come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And you can make an appointment right online, drjoe.com, drjoe.com. That's my website. You can call us. We accept almost all insurances. The first visit, normally to come see us, if you walked in off the street, $940. I've reduced that for my listeners to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. And I do that because I want to find out what's going to be the best course of treatment for you. Is it chiropractic care? Is it orthopedic care? Is it injections? Maybe it is these drugs, the GLP-1 agonists. Maybe it's just nutrition. I don't know that until you come in. And when you come in, we put together a protocol for you, and then you can decide what to do. So stop suffering. If you have issues, neck pain, back pain, shoulder pain, digestive issues, drjoe.com. Book your appointment right now. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can give you information about your insurance. We have to usually check your policy specifically because there's so many different policies. But we take Medicare. Like I said, I treat car accidents. I teach other doctors how to deal with car accidents, doctors, lawyers, physical therapists. So a lot of companies turn to us, even insurance companies turn to us when they need an evaluation for their injury cases. So why not go to the place that everybody, not everybody, but a lot of people send their tough cases to? drjoe.com, book your appointment, stop suffering. When you come in, I hear it every day. Patients say, why didn't I do this sooner? I don't know why I waited so long. I don't know either. So drjoe.com. And again, if you're ever in a car accident, if the car is damaged, you're damaged. I've never seen it any other way. You will get calls from scammers. I promise you. Hey, this is a survey company. This is the National Accident Association. They'll make up all sorts of crap. And they'll say, go see this doctor and this lawyer. So how do you know it's a scam? If somebody you know don't know calls you and says, go see a doctor or lawyer, it's a scam. It's a felony, in fact, as a matter of fact. Do not fall for that. You will not get the care that you deserve. You will not get the legal representation you deserve. I've never seen it that way, and it's illegal. So there's nothing they can say about me saying that, because what they're doing is illegal. So even if you're not in our area, let me know. I'll try to find a doctor in your area that I think might be able to help you. I know a lot of doctors. So drjoe.com, great. We have over 4,000 hours of content there. So you can search the website, put in what you're looking for in the search bar. Supplement-wise, we're going to talk about that next, how to lose weight. That's coming up next, so make sure you hang on there. The things you can do, what causes us to gain weight, and then what we can do to help reset the brain. It's all in the brain, by the way. Make sure you follow me on social media, Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. We post every single day. Every day you're going to get a post from me, 1-minute post. If you like the long version, that's YouTube. But every day you're going to get a post from me. And it's a 1-minute tip. And if you don't like it, unfollow me. It's just that simple. But it's always 1-minute tip, good information. I find that a lot of people have short attention spans. And you just got to give it to them with little tiny bites. And it works out real well. So if you want to follow me, I think you should. If you're a podcast junkie, just go to Dr. Joe for the health of it. Dr. Joe for the health of it. And we post at least 2 podcasts a week, sometimes more. So you have podcasts. You have social media posts. You have YouTube for the long version of things. You can send me your questions through your website, drjoe.com. You can search the website. That's a lot of information. And a lot of doctors go to my website and search. They say, well, what do I do for this? I'm not sure. Let me go see what Joe would recommend. So I want to be your doctor. I want to help naturally get you well and keep you well. So drjoe.com. And again, send me your questions through the website. Happy to answer them for you. Almost going to go to break, but before that, I want to talk about when you're hungry, you're not hungry for food, you're hungry for nutrition. And if you're eating a nutrient-dense diet, the chances are you're going to eat a lot less food. I'm also going to talk about how to beat sugar cravings. Because if you're like me, and I think you are, you can't eat a cookie. You can eat a box of cookies, but you can't eat a cookie. And the reason is when you eat sugar, and I did a social media post on casomorphines, which is a protein when it gets in your digestive system, stimulates the pleasure centers in your brain. And that's why a lot of people have trouble giving up dairy because it tastes so good, cheese especially. And I don't know, we might have went viral on that one. We might have gone over 1 million views, I'm not sure. But so many comments. And people get mad at me. Well, that's not true. No, casomorphines are a thing. It happens in your colon, goes into the nucleus accumbens in your brain, stimulates the release of dopamine. Some people are affected more than others, but yes, it's a true fact. And with sugar, the same thing, stimulating the pleasure centers in the brain, releasing dopamine, and you want more. Now, not everybody has the same reaction. I can't drink alcohol. If I even take a sip of alcohol, I feel it. I don't get drunk, but I feel it. Other people can drink a 6-pack and not have a problem. Some people can drink coffee at night and go to sleep. Everybody's different, but the mechanism is the same. It's still happening. It depends how your body responds to it. And so if you like these fun facts, just make sure you follow me on social media because it's nothing but fun facts, and it's a blast. And read the comments. The comments make me laugh. You know, some of the folks it's usually men, by the way, too. I don't know why. But men are just angry. If you say something they don't like to hear, like cheese can affect, can have adverse health side effects, they have keyboard courage. They get tough, and they start getting tough. But, yeah, follow me. It's kind of a little fun. It's entertaining, and it's also educational as well. All right. Any questions, send them to me through my website, drjoe.com. When we come back, we're going to talk about the best snacks that you can eat to help lose weight. And we're going to talk about how to curb those sugar cravings as well. Set up an appointment, drjoe.com. Love to be your doctor. Any questions, drjoe.com. Follow me on social media, Facebook, Instagram, YouTube, TikTok. And then podcast is Dr. Joe for the health of it. We're going to talk about supplements coming up. My opinion on supplements is this. I don't think they're a luxury. I think they're a necessity. Because even 20, 30 years ago, we didn't have steroids, chemicals, hormones, antibiotics, pesticides, genetically modified food, glyphosate, these stimulants in the food, ultra-processed foods. So the world is changing, and you can change with it or not. And I prefer that you fight it a little bit and eat the good stuff. Folks, Dr. Joe, drjoe.com. I'll be right back. I had too much to talk about, John. I can't stop. All right. Anybody have any questions today?
Does a 12-hour daily intermittent fast eventually push you into ketosis?
No, that won't do it. It's going to take a little longer than that. But ketosis may not be the place you want to be. It turns out that your body does need some carbohydrates. And in fact, even people like Dr. Joe Mercola, he's a medical doctor, number one. He's brilliant. He has great information. And he was promoting this high-protein diet and going into ketosis for years. Well, for about a year or so. And then he looked at the long-term research. And he came out, he says, I was wrong. Your body works best with some complex carbohydrates. Now, complex carbohydrates is not ice cream. It's not cookies and candies. It would be things like beans, lentils, split peas, resistant starches. Like if you make an organic potato, put it in the refrigerator overnight and cool it, and then eat it the next day. You absorb about 40% less starch. So even the researchers who were all gung-ho originally, when they look at the long-term studies, realize that it's not something you really want to go to. So ketosis is not going to happen in 12 hours, but everybody should fast at least 12 hours a day. So if you have dinner at 5 o'clock at night, don't have breakfast till 5 o'clock in the morning. Yesterday, I had dinner at 4 o'clock. 3:30, 4 o'clock I ate. And I didn't eat again until 7 o'clock. So that gives me more than 12 hours. Because after about 8 to 10 hours, your body starts to burn fat. And so if you're eating every 6, 8 hours, you're not going to lose fat. You can't. Okay? I mean, some people can, metabolism issues. But you want to spread out that fast as long as you can. Ideally, 12 hours minimum, 14, 16 hours every now and then is great. So what else you got?
What is the best way to cook sweet potatoes? Should I roast them with coconut oil?
If you want to roast them, great. That's fine. If you're going to roast them, absolutely use organic coconut oil. You can also boil them or bake them. That's fine. But do put them in the refrigerator overnight. And then it becomes a resistant starch. The starch molecules change their molecular structure, and you absorb about 30, 40% less carbohydrates. And what isn't absorbed becomes a prebiotic to feed the good bacteria in your colon. And if you do eat anything underground, garlic, onions, potatoes, I do recommend organic only. So, what else you got?
I've heard that baking apple slices with cinnamon and honey is a delicious and healthy alternative to apple pie. What are your thoughts?
Yes, absolutely. Yeah. If you're going to do apples, I recommend organic, or at least peel them, because if they're not organic, you're going to have pesticides on. They dip it in wax, and the wax locks in the pesticides. If you're going to use honey, I recommend organic, local honey. Most, that's my opinion, of the imported honeys are cut with sugar. They're cut with sugars, especially ones from China. So organic local honey is going to be your best bet if you're going to do honey. And cinnamon is great because cinnamon helps stabilize blood sugar. I recommend Ceylon cinnamon, Ceylon. I think I'm saying that right, Ceylon cinnamon. And that'll help stabilize the blood sugar as well. But yeah, it's a much better alternative than a bunch of sugar and flour and wheat and dough and everything like that. So yeah, if you're going to do it, that's fine. I'm okay with that.
I've heard that LDL, the bad cholesterol, has two components, the large buoyant type that isn't harmful and the small dense type that is harmful. What are your thoughts? Yes,
that is correct. There's LDL, there's VLDLs, there's lipoprotein small a. So we just knew about, HDL and LDLs. Now we're finding out the LDLs are broken into many different components. But here's the thing with cholesterol. Cholesterol unto itself is not a problem. It's when a cholesterol oxidizes and sticks to the artery walls, that's when it becomes a problem. Now, we need cholesterol. Cholesterol we use to make hormones. Our cell walls need it. So it's very important that we have cholesterol. But if it starts getting too high, I want you to ask yourself a question. Why is my cholesterol so high? And medication can bring down the cholesterol, but the same enzyme that produces cholesterol also produces something called coenzyme Q10. So if we take a medication, and I'm not against you taking medication, please understand that. If you're going to do it, that's your call. But you're going to lower your coenzyme Q10. Now, CoQ10 gets into the mitochondria of the cells and helps the cells generate electricity. So this is why a lot of people, when they take statin drugs, get very tired. because the CoQ10 levels are low. So I do recommend, if you do take cholesterol-lowering medications, I do recommend you take CoQ10 as well. In fact, I did a show one time years ago, and I talked about this. And a friend of mine, he was dating a pharmacist, and he called me up. He says, my girlfriend is mad at you. She's never heard that before. And I said, well, just because she never heard it doesn't mean it doesn't exist. You have to hear something the first time for everything. So she looked it up, and she called me. And she said, I was wrong. I'd never heard this before in all the years of pharmacology school. I never heard this before. She goes, thank you. And she goes, every patient now that I fill a prescription for statin drugs, I point over to the counter. I said, go get yourself some CoQ10 as well. So how many people's health were impacted in a positive way because of that? So if you're taking statin drugs, I do recommend that you consider CoQ10 as an alternative as well. And again, if you get your cholesterol tested, you also want to get your A1C tested. That's going to talk about sugars. And then you want to get your C-reactive protein tested, which is going to talk about inflammation. And then you want to get your homocysteine tested. Homocysteine that's one of the amino acids that can actually irritate and cause the cholesterol to stick to the artery walls. So it's a lot more than just, hey, I got my cholesterol tested, this is what I got. There's other factors I want you to consider as well. So, what else you got?
That is all.
Oh, that was it. Great. Okay, let me have a little sip of tea here. I got slippery elm tea, and I added some anise seeds to it. So it's a slippery elm with a little licorice. It already has a licorice flavor. I added some anise to it, so it's really kind of tasty if you like licorice. It's great. We're ready for part 2? Okay. Hey, folks, Dr. Joe. If you stayed with me, thank you. If you're just joining us, welcome. Glad you could be here. What we're talking about today, we talked about the A, B, C's, and D's of weight gain. And what happens when we have weight on our body. A is for arthritis, because the joints wear out from the excess weight. And if joints are out of alignment, you got to put them back in alignment. That's chiropractic care, so that's a no-brainer there. B is for blood pressure, because the visceral fat can compress the kidneys, and that can actually raise the blood pressure, pushing sodium back into the blood. And B is for back pain too, because that puts a lot of stress on the joints. C was for cancer. We talked about how sugars can cause the body to release certain fats that can actually feed cancer cells. And the D was for diabetes. The number one preventable cause of type 2 diabetes is weight gain. So all that being said, it's hard. I know it's hard to lose weight. So let's talk about some really good snacks, or foods, actually, meals, that I want you to start incorporating into your diet to help with that. So weight loss doesn't have to mean boring, flavorless snacks and foods. You can fill up your diet, keep your loved ones engaged, feel good, and also lose weight at the same time. And that'll help you stick to it long term as well. Because remember, when you're hungry, you're not hungry for food, you're hungry for nutrition. Your brain says, your hypothalamus says, I need nutrients. Feed me. Right? Remember that movie, Feed Me, Seymour? And so your brain is saying, feed me, Seymour. And we've got to get those nutrients up into the brain. And that's why a lot of people tell me, myself included, when they take supplements, a lot of their cravings go away. And I hear this every day because it's pretty simple science. So the one supplement, or two supplements I hear about the most are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. And when you take them, it's prebiotics, probiotics, digestive enzymes, complete multivitamin, fruits and vegetables in a powder form, chlorella and spirulina help detoxify the liver, omega-3 fatty acids, iodine. And all these come together, and the body says, ooh, that's exactly what I was looking for. Thank you. I appreciate that. Now, you can't just live on those, because your body does need calories and fiber and things like that. But Super Greens is an essential source. If you're not taking at least Super Greens is an essential source, you should. That's the minimum supplements everybody should take every day. And they're on the website, drjoe.com. Relatively inexpensive, way cheaper than a cup of coffee. And so there's no reason not to take them. They're easy. They taste good. They're non-perishable, so they can sit in your counter, which they shouldn't. You should get a new batch every month and take them. They're less expensive than coffee. They give you lots of energy. They help control your appetite. They're giving you the body the minimum nutrients that it needs. I can't think of a downside to taking them. And very soon, we're going to have different flavors. We're going to have mango essential source, and we're going to have berry-flavored Super Greens, and those are coming in very shortly. And so if you've tried them in the past, you could try the new flavors. If you like them, great. If you don't, go back to the old ones. We're going to have all of them. But absolutely, I can't fathom why you're not taking those if you're not. So let's help you stay on track, because the way to lose weight is we got to get the body feeling satisfied and giving the body all the nutrients that it needs. So let's give you some options. One of the things, and I remember I ate this a lot as a child, was apple slices with peanut butter. Now, a couple of things I want you to consider if you're going to do that. Number one, it's very filling. It has a little sweetness to it. And when you eat protein with a sugar, even fruit, it's going to slow down the absorption of that sugar. And it's going to make you feel fuller longer. So if I have a nut butter, and I don't like peanut butter. Not that I don't like the flavor of it. It's not my favorite nut butter, because peanuts grow underground. Many times they have mycotoxins in them. They're high in arginine, and arginine can stimulate herpes viruses and cause herpes outbreaks. And I have a lot of people get herpes outbreaks when they eat peanuts. And so if you're going to eat nut butter, I'd recommend cashew butter. Cashew butter is my favorite by far. Almond butter. There's filbert butter. I mean, there's other nuts you can make butter out of. Sunflower seed butter. But be careful, because if you're going to eat a lot of nut butters, they're very high in fat. They're very filling, but they're very high in fat. And I was talking to a buddy of mine, and one of his friends, his wife made him sugar-coated pecans, I think it was, or almonds, I forget what it was. And he said they were so delicious. They were sugar and they were cinnamon, and you've had those before, probably the roasted sweetened nuts. They taste great. But the problem is you want to keep eating them, because sugar stimulates the pleasure centers in your brain, and then you get all the fat from the nuts, and you can really pack on the pounds with those things. So if you're going to do it, maybe cut the apple in 4 pieces, put a little bit of nut butter on each one, and you're okay with that. But it can cause weight gain with too much nut butter. So don't think nut butter is healthy. I can eat as much as I want. It is healthy. Eat a little bit. And I know I can eat a handful of nuts and I'm okay. As soon as I get to 2 or 3 handfuls, I start to notice the next day that I feel like I'm putting on weight. So just be careful with that. But apples are high in fiber. Fiber swells up in your colon and pushes the sugar through the colon very slowly. You get a slow release of the sugar, and it makes you feel good. Okay, so apples and peanut butter, apples and almond butter, cashew butter, great choice. Just be careful with it. Another great snack, and I eat this a lot, is hummus. Now, classic snack, great for weight loss. The chickpeas, as a base, they're a base to the spread. They're filling. They have fiber. They have protein. You can eat them a couple of different ways. One of the ways I like to eat it is I get hearts of romaine. And it's just a big romaine leaf, and you can just get a head of romaine lettuce and use it too. And then I put the hummus in there, roll it up or just wrap it up and eat it that way. And the cold, fresh lettuce, along with the hummus, is just a spectacular snack. And it's so inexpensive. Now, you can buy hummus in a grocery store, of course. That's easy. I like making my own. A, I like the flavor better. And B, it's a whole lot cheaper. I'm amazed what they charge for hummus. Now, you can get a can of organic chickpeas. And I take that, drain the fluid off, put it in a food processor, put in some tahini, which is sesame seed butter. And then I'll add a little, you could add garlic to it, lemon juice. If you want to put a little extra virgin organic olive oil in there, that's fine. I usually don't, because the tahini has oil in it. And you can put cumin in it if you want to, and just put it in a food processor and whip it up. And I like my hummus thick. And that solves the problem. Now, if it gets too thick, it won't go through the processor. I take a little of the water, the fluid that's in the chickpeas, and I pour a little bit in at a time to make it that thick consistency that I really like. You can add black pepper to it. You could add olives to it. You could add red peppers to it. But just be careful. If you're adding red peppers or olives, do that first, because that's a lot of fluid, and you won't have to add the extra fluid. In the first book I ever wrote, Eating Right for the Health of It, I have a recipe for hummus in there. And you can get the book, which I think you should, and it has 200 plus other recipes as well. But hummus is great. Now, if you're not as creative and you don't feel like making it, that's fine. Just buy it. And you can eat it with carrots. You can eat it with celery. You can eat it with the romaine lettuce, as a boat, and just fill it up with that. I just love it. And many times, that's my lunch. Because it's quick, it's easy. I have the tahini in my refrigerator. I have the chickpeas in my pantry. And I wake up in the morning, I don't have a lunch. I'm like, what am I going to bring? Let me make some quick hummus. Now, you have to have the romaine lettuce to go with it if you do it that way. But you could just eat it with a spoon if you want to. So filling, so good for you, high in proteins, and it's great with good fats. No downside. So if I had to pick like one of the ultimate snacks, it would be hummus. It's pretty awesome. Now, other snacks, we're talking today about snacks you could eat to help lose weight. Yogurt and raspberries. Now, you can do Greek yogurt, but I'm not a fan of dairy products. If you've listened to me before, I don't recommend dairy products. So now, just recently, I see that they have Greek yogurt made with plants. And Silk is a brand name. Again, I have nothing to do with the company. But you can do that and add some berries to it. Blueberries, raspberries. That's going to add the sweetness. The Greek yogurt is pretty low in sugar. It makes a great snack. It's high in protein. You could add nuts if you want to. If you could add sunflower seeds, almonds, walnuts, pecans, pistachios, whatever you'd like. And it's going to be great. But again, only about a handful of the nuts. So if you do a handful of the nuts with the yogurt and you want to throw some raspberries or blueberries in there, what a great snack. Quick, easy, and all these things are so cheap. It's so much less expensive than going out if I'm going to get some fried chicken and some gravy and some French fries and a soda. I saw one of the restaurants now, I know during COVID, prices went up dramatically, and now restaurants are trying to lure the people back in. And so I saw you get a cheeseburger, all the fries you can eat, and all the soda you can drink for $9.99. And I thought, that's a really expensive meal. Not because it's $9.99, but the long-term effects. The fats, the polyunsaturated fats that they cook the French fries in can affect blood sugar. They can clog up the receptor sites, and insulin can't get into the cell to allow sugar in. When the French fries fry, they create something called acrylamides, which are carcinogenic. The soda, of course, we have high fructose corn syrup, which just blows up your cells. If you use artificial sweetener, it's an excitotoxin to the brain. So I look at these things and I think, wow, there's so many things wrong with this commercial, and it's so much more expensive than $9.99. But look good. I'm sure it tastes good. Absolutely. I have no doubt it tastes great, but it's not the type of thing you want to do. One of my friends, he's in a TV business, and he called me the other day, and he told me he has prostate cancer. He told me this a while ago. He said, I was listening to one of your shows. He goes, you're right. I gotta make some changes. It's time I make some changes. The prostate cancer, of course, can be deadly. He said, I got to lose weight. I want to get on your supplements. He says, your shows are just amazing. There's nothing like it in the world. And he's a TV producer. He says, nothing like your shows in the world. And I just love what you're doing. Love to get you on TV as well. I said, okay. And he said, yeah, I'm here with my friend Bill, and Bill loves your shows too. And I said, great. And I said, where are you? It's at a pancake house. I said, okay, so being at the pancake house, telling me you have to change your life, what's wrong here? What's wrong with this picture? He said, but this is it. I'm going to make the change, and I hope he does. Another snack you can eat to help lose weight is air pop popcorn. Now, if you're going to do popcorn, I recommend organic popcorn because a lot of the other popcorn is genetically modified, and there's a lot of controversy over genetically modified. But air pop, you take the fat out. Now, a cup of air pop popcorn is only about 30 calories. It's going to give you about a gram of fiber. You need about 40 grams in a day, but don't eat 40 cups of popcorn, of course. So that's great. But without the butter, popcorn is boring. How can I make it sexy? How can I make it taste better? Here's a really cool trick I learned years ago. You can get some tamari, which is like a high-end soy sauce. It doesn't have monosodium glutamate in it. And if you're gluten intolerant, you get gluten-free tamari. And just put it in a little spray bottle. And spray it on the popcorn, fine mist, and that's going to give it salt and liquid, and then sprinkle something called nutritional yeast on it. Now, nutritional yeast, some of you, this is going to be a very new food for you. Nutritional yeast is unbelievably healthy. It's loaded with protein. It's loaded with B vitamins. Many of them are even fortified with B12. And it has a wonderful savory flavor. I can almost compare it to cheddar cheese. Not exactly like cheddar cheese, but that type of savoriness to it. And if you can spray it on, that makes it liquid, so that it gives you a little moisture so that the yeast sticks. And you could eat a lot of popcorn made that way. Now, does it taste as good as hydrogenated oil made in a movie theater? Nah, probably not. But what a great snack. It's fun. I like fun foods. I like foods you can play with and eat. And it's very inexpensive. It's great for you. Good source of fiber, low in calories, nutritional yeast, high in protein, high in B vitamins, sometimes B12 if it's fortified. Now you took something that's really bad, movie theater popcorn, and turned it into something that's really good, organic popcorn. And an air popper you can get for probably $10, $20, brand new, okay? So that might be a fun little thing to start considering. When you start to get hungry, you want to get something crunchy. That's kind of neat. If you eat eggs, I don't, but if you do eat eggs, do organic eggs, and hard-boiled eggs would be a good choice. Loaded with protein, very filling. Hard-boil your eggs. I haven't had a hard-boiled egg in almost 40 years, but it's an option. Edamame. Edamame is soybeans. And edamame is great. I want you to do organic again because a lot of soybeans are genetically modified, but relatively inexpensive. You can just boil it, sprinkle on some air-dried sea salt to it, and eat that. Very filling. You can even make edamame hummus. Now, I don't like it as much as the chickpea hummus, I'll be honest with you, but you can do edamame hummus. You can do chickpeas and edamame if you want to. So edamame is a good thing to do. Make sure it's organic because then you don't run the risk of genetically modified foods. We talked about nut butter earlier, and nut butter can be an issue or nuts because they're so fattening. Got a message on my website, drjoe.com last week. And by the way, if you have a question, send it to me through my website, drjoe.com. Happy to answer your questions. I get many, many, many questions every day. Some days it's, 20, 30, 40, 50 questions sometimes. And I answer them all. And the guy said, I'm not trying to lose weight, I'm trying to gain weight. He says, what can I do? And I said, eat more nuts, nut butter, and avocados. Now, half an avocado a day, you're fine with that. Start eating 1, 2, 3 avocados a day, you're probably going to notice you're putting on weight. Nuts, handful, probably not that big a deal. More than a handful, you're going to probably notice you're going to start to put on weight, and especially not peanuts. Remember, peanuts can cause herpes outbreaks because the arginine can stimulate herpes viruses, have a mycotoxin on it, a fungus that can grow, and that can cause allergic reactions. So just be careful with the peanuts. I'm not a big fan. Sorry, Jimmy Carter. Don't get mad at me. But nuts are great. If you can eat them raw, that's the better choice. When you roast the nuts, the oils are then heated, and when oils are heated, they change their molecular structure. And that's why if you're going to cook, I recommend coconut oil only. Avocado oil maybe, but that's expensive. But coconut oil is the one oil you want to cook with. Olive oil, extra virgin organic olive oil, you can use as a raw oil. But that's about the only oil you should be using because the oils are very satisfying, but the polyunsaturated fats, the corn, the soy, the canola, the safflower, the sunflower, those are toxic. I wouldn't recommend you do that, okay? The canola oil is made with something called rapeseed, and many times the rapeseed is genetically modified as well. So canola oil is bad for so many different reasons. But the nuts are great. Just be very careful with them. Maybe a quarter cup or less. That's about a handful. If you're just tuning in, we talked about the ABCs of obesity and weight gain. And A was for arthritis, B was for back pain and blood pressure, C was for cancer, D was for diabetes. And when it comes to back pain, well, I can tell you this. Every patient that comes in our office, we do a nutrition workup on. And the reason I do that is I truly believe you can't put together a healthcare protocol for any field without looking at the patient's nutrition. No matter what it is, no matter what type of doctor you go to, gynecologist, proctologist, psychiatrist, orthopedist, neurologist, neurosurgeon, general practitioner, everybody would benefit from making sure they're eating the right foods and taking the right supplements. The minimum supplements I would recommend, I got a pack of 4, I say, Super Greens, Essential Source, Vitamin D, and B Complex. That's the minimum. Now, I also take omega-3 fatty acids for my brain, and also it helps with inflammation. We talked about that last week. Omega-3 fatty acids are essential. You have to get them from an outside source. So those are important. I take estrogen regulator to help prevent my testosterone from converting into estrogen, because as I get older, I'm losing my testosterone levels, and I don't want to keep converting it into estrogen, and that we take something called diindolylmethane for that. I take men's hormone support. The raw materials help build my hormones up. I take digestive enzymes. Whenever I eat a cooked meal, I take a digestive enzyme. On the weekends, many times in the winter, I'll make soup. So if I eat a soup, lentil, split pea, whatever it is, vegetable, I'll take digestive enzymes because it's cooked. If I have my hummus and romaine lettuce wraps, I'm having a salad in there. I don't have to worry about it so much. But if I eat a cooked meal, always a digestive enzyme. You should too, by the way. Just carry them with you. If people have had their gallbladder removed, they're not processing fats properly, that can cause them to put on weight. So if you send me an email through the website, I'm going to tell you about a supplement. It's called Colacol that I feel should be the law. If you've had your gallbladder removed, you have to have this excess amount of bile to digest your fats. And I don't know why every person that had the gallbladder removed, the doctor doesn't say, get yourself some ox bile. And it's about $18 a bottle, the one I recommend. There's some cheap ones on the market I wouldn't recommend. So send me an email. I'll tell you which one I recommend. And it's not even my company. But it's $18 a bottle. I'll give you the link because you can't buy from them. You have to go through my account. And I do benefit from that a little bit, but hardly anything. And you have to go through my account, and then you can order. And it's so important you take Colocol. Carry it with you. Anytime you eat something fatty, take it. But if you have pain, back to the pain issue, neck pain, back pain, shoulder pain, numbness, tingling, sciatica, shoulder pain, come see us. My team of doctors are really good at getting to the cause of the pain issue, not just treating the symptoms. Like I said, I'm the only chiropractor in the whole state board certified in pain management. So if you want to make an appointment, drjoe.com. We accept almost all insurances, Medicare, car accident, sports injury. We're even on the VA referral network. If the VA refers you to them, they pay your bills because we're on their referral network. So drjoe.com, and we accept almost all insurances. Normally the first visit is $940. For you, my listeners, I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Why wouldn't you do it? What are you suffering for? Acid reflux, there's a way you can actually adjust the stomach, pull it away from the diaphragm, and in many cases, get to the cause of the acid reflux. So we have a lot of tricks up our sleeve to figure out things. Knees, shoulders, we have a machine called acoustic wave therapy. I had a lady come in the other day, was told, no uncertain terms, she needed to have a hip replacement and a knee replacement. So we realigned her spine, got everything lined up. We did the acoustic wave on her, and she said, I can walk without my walker. It's incredible. She goes, they were going to cut my knee and my hip out, and now I can walk without a walker. Now, not everybody, it doesn't work for everybody, but why not try it? Very inexpensive, a fraction of the cost of a replacement. So if you're serious about wanting to get well, drjoe.com. If you have questions about your specific issue, send me questions through the website, drjoe.com. I'll answer them personally. The supplements we talked about, the super greens, the essential source, the nitric oxide, the B complex. Nitric oxide increases your blood flow, by the way. It was funny, I posted on social media about nitric oxide. Some guy said, it doesn't do that. No, by definition, that's what it does. So I said, all right, well, then don't take it. It's fine. I want to deal with people that want to get well. So nitric oxide relaxes the blood vessels and increases circulation to the body, may even help lower blood pressure. So all the supplements we talk about, drjoe.com, but at least Super Greens Essential Source B Complex and vitamin D. Please, please, please. And if you could do more, I'm happy to put together a protocol for you. And we ship the same day or the next business day. Or come pick them up. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Best thing you can do is make an appointment to come see us. Let's check your nervous system. Let's check your digestive system. Let's look at your diet. Let's see if you have any deficiencies. Let's see if we can fix that digestive issues that you have. Maybe it's a stomach adjustment you need. Let's look at the knees, the hips, the shoulders. Are they wearing out? Would acoustic wave therapy work for you? We have PRP. We have a medical doctor we work with. We can get PRP injections. PRP is we take your blood, spin it down, inject it back into the joint to stimulate new growth. Now, if you've had PRP or stem cells in the past and didn't get results, the missing link, I find, is acoustic wave therapy in many cases. So we do the acoustic wave and the PRP, and that's when we start to see better results. Again, I wish I could promise it's going to heal everybody. I can't make any promises, but I can tell you for the cost and the low risk and the high reward, it's probably a direction you want to go in. So drjoe.com, just do that. Follow me on social media. We post every single day. Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. So we're talking about snacks that you can have to help you lose weight. We talked about the hummus. You can also make roasted chickpeas. Roasted chickpeas are great. You can make them yourself. You can buy them if you want to. But it's a great alternative to chips because it's crunchy. You can add salt to it. It's salty. And it's high in protein as opposed to having the toxic chemicals and the acrylamides that are formed. Now, I start my day with Super Greens and Essential Source every day. And countless patients have told me, Dr. Joe, I eat so much less food when I take Super Greens and Essential Source. Now, it's not going to happen the first day. It's got to build up over time, a couple of days probably. And you're going to notice I just don't have those cravings, that 10 o'clock cravings. You know, I can wait till lunch now without having a snack because the body is requiring nutrients when it's hungry. So the first thing I do is I take Super Greens and Essential Source, got a little jar. I add some unsweetened almond milk or coconut milk. I add my 10 drops of vitamin D, shake it up, and drink it. Now, you can also make a smoothie with it. If you want to throw in frozen berries, blueberries, raspberries, strawberries, and whip that up into a smoothie, that's great too. Now, you can add the Super Greens and Essential Source if you want to. You can add a frozen banana, which will make it creamy, but the banana is going to raise the caloric intake. Now, I'm okay with it because I don't have to worry too much because I eat a good diet. But smoothies, man, let me tell you, just amazing. When you make it with Super Greens and Essential Source, if you're making your own already, just add the Super Greens Essential Source and vitamin D, and boy, you've supercharged it. So that's another fun snack that can make you feel full. We talked about the roasted chickpeas. If you have any questions, I realize I got so much more to talk about. Oh, how to beat sugar cravings. When you get a craving, eat a pickle, a dill pickle. Dill pickles help beat that sugar craving. It's amazing how that works. I'm almost out of time, and I'll explain it to you on my next lecture. If you have any questions, send them to me through the website, drjoe.com, drjoe.com. Make an appointment to come see us. Offices in Marietta, Duluth, Stockbridge, and West Cobb. Podcast. We do a podcast at least twice a week. It's Dr. Joe for the Health of It. Dr. Joe for the Health of It. If you can't remember anything I said, I know I talk fast, send me an email. Happy to answer it for you. We work with men with erectile dysfunction even. We try to get to the cause of that. We try to get to the cause of all your health issues. So any issues, send me an email or just make an appointment, drjoe.com. I want to get you well, and I want to keep you well. Thanks for tuning in. Catch you next time. Bam. You have questions for me?
What are your favorite types of beans? Are baked beans okay?
Baked beans are going to have a lot of sugar in them, so just be careful with that. I like all types of beans. I mean, I'm Italian, so cannellini beans. Of course, we make something like pasta fazool. We use a gluten-free pasta with that. You can do it with quinoa if you want to. It works real well. The pasta fazool recipe is in my book. It's what I grew up on. And I remember in high school, my friend Kurt would come to my house if I was at football practice, and like he and I were actors together, but if I did football, he didn't play football. He'd go to my house and ring my doorbell and say, call my mother's mom and pop. She's from New Jersey. Everybody's friends are mom and dad. And say, what's for dinner tonight? And my mother would actually sometimes make him pasta fazool and salad. He loved her salad. And I'd come home, and he's sitting there having dinner with my parents. I said, what are you doing here? He goes, I decided to stop by, see what your mother was making for dinner, see if I want to stay or not. So pasta fazool or pasti fagioli, if you want to pronounce it like it's spelled, that's a great way to do it. I like refried. Just make sure they don't have lard in them. So I like the refried beans. Black beans are great. You can add black beans. I've already eaten a can of organic black beans and hot sauce, and that's a meal. So they're all good. Lentils, split peas, I don't know. They're all wonderful. I eat them just about every day. What else you got? And take your digestive enzymes with them.
Some restaurants have yellow rice as well as orange rice. It's delicious, but are they okay to eat?
Again, it's going to probably spike your blood sugar like crazy. And many times, like the Mexican rices, they're going to add chicken broth to it. And chicken broth oftentimes has monosodium glutamate in it. So that wouldn't be something I would recommend. Rice, unless it's a resistant starch, you cook it, cool it, eat it the next day, I'd probably say limit it. Now, I don't avoid rice altogether. I went to this great vegan restaurant the other day, and I got some curried vegetables and tofu, and I had rice with it, and I ate the rice. But again, I had a protein with it. The protein is going to slow down that spike of blood sugar with it. Rice by itself wouldn't be a good idea. Probably the yellow rices, most of them are just going to be, again, Mexican rice would just be chicken broth that's making it yellow. So probably no. I'd say no to that.
I enjoy barbecue sauce. What are some ingredients that I need to avoid?
Well, the high fructose corn syrup is going to be the big one. I mean, I like barbecue sauce too. But if you're going to do barbecue sauce or ketchup, which I wish you wouldn't, but at least do 80% of what I say. Or 90% would even be better. And that 10%, you can give yourself a little leeway. But if you're going to do a barbecue sauce, I do an organic one. You're not going to have you're not going to have high fructose corn syrup in it. And there's different types. There's mustard, there's low country, I don't know, there's different types. And the smoky flavor can also be carcinogenic. Now, is that little bit of smoky flavor going to cause cancer? If you have a very good diet, no. But if you don't have a good diet, it's just one more nail in the coffin. So I would say do organic barbecue sauces if you're going to do them, and limit them because they do have a lot of sugar in them. So.
If I need to lose weight, how do I make sure that I burn fat instead of muscle?
You keep moving. It's very simple. As long as you're moving, those muscles are going to stay fine. And so when I say moving, just walk. When I do my radio show at the radio station, it's a desk. And every time we go to commercial break, I just walk in circles. And I feel so much better when I do that, because I've tried sitting down. I've tried all the different things. And if I sit down and do my show, I don't feel good. If I get up and walk around, I feel much better. And so the show is much longer than this, of course. So you got to get up and you got to move. So you're not going to lose muscle mass as long as you're doing it the right way. And if you go to my website, drjoe.com, just put in weight loss in the search bar. We kind of break it down for you there. And then we have a 21-day protocol I'd recommend you do, which can really help you burn the fat, not lose the muscle. And it's a real good way to jumpstart the program and get you excited about it. So just type in 21 day. I'll give you the information on that protocol. So type in weight loss and 21 day. What else you got?
What do you spray on air popped popcorn before adding nutritional yeast?
You can do something called tamari. Tamari is like an organic, a high-end soy sauce. They also have something called liquid aminos, which are made with coconut. They work real well. But a lot of commercial soy sauces are just loaded with salt and monosodium glutamate. That's why I recommend tamari or aminos. And just get a little spray bottle. Spray it on. A little nutritional yeast. Then you could add pepper to it if you want to. You could add, red pepper if you want to, garlic, and just kind of season it the way you want. Ginger if you want to do that. White pepper is a little different than black pepper. Red pepper, it's all different flavors. So you can get crazy with it, but the key is tamari or liquid aminos.
In regards to the popcorn, why don't you recommend avocado oil or EVOO?
EVOO. Yeah. Extra virgin organic olive oil. EVOO. That's a, God, I can't remember the chef who came up with that. She made it popular. Anyway, because the oils, if you're going to cook them, it's going to raise the caloric content dramatically. Even if it's a good oil, it's still going to raise the caloric content. Because you got to remember, a gram of fat has about 3 times as many calories as a gram of carbohydrates or proteins. So if I have this much fat and this much protein, exactly amount is going to have 3 times the amount of calories. So that's why we're trying to cut back on the oils. And that's why I recommend the air pop. And that's why you want to wet it with something like tamari.
That is all.
Great. Thanks, guys. Appreciate it. Send me a question through the website, drjoe.com. Share my posts, because you follow me on social media, I hope. Share them with your group, and let's see if we can build this thing up. Let's get people well. And if you have any thoughts